Hello, and welcome to Miami University. My name is Terry Bazell, and I am the Director of Health Services on the Oxford campus. I am here today to go over the important information you need to know about Miami University's health services. First, we will go over the location. Student Health Services is located at 421 South Campus Avenue, right next to the parking garage. We are run by TriHealth, which is one of the largest healthcare networks in the greater Cincinnati area. What this means for you and your student is that we can arrange priority appointments with specialists should the student need those services. Also on this slide, you'll see the phone number as well as the website and the email to contact the clinic. The first thing we're going to talk about are the two required actions that are important for you to complete as soon as possible. One is all incoming students are required to submit medical and immunization records. This process is handled by a program known as MedProctor. It allows you to do an immunization certificate completion and upload all your forms there. And once they're done, they're done. You don't have to do them again during your time at Miami. The second thing we'll talk about is insurance coverage. The deadline is August 1st of 2020 to waive or enroll in the student health insurance that's provided by Miami. We will get into some of the details on that a little bit later. This image is a picture of the Student Health Service website. As you can see, there is a link to get you to the health insurance waiver/enroll site. There is information about the hours of operation. Our hours are Monday through Friday, 8 to 6, as well as the portal to get to the immunization, MedProctor, as well as how to arrange your appointment. First appointment, the student will need to call the clinic and choose option 1 and schedule the appointment. Once the appointment has been completed, the student will have access to MyChart, which will allow them to schedule appointments and send messages to providers through the MyChart application. After hours, outside of those 8 to 6 hours, we do have McCullough Hyde Memorial Hospital located just blocks away from the campus. It is a full-service hospital, so there is an emergency room as well as any other services that may be necessary. That hospital is a TriHealth hospital, so there is collaboration between the Health Services Center and McCullough Hyde. The next slide tells the 2020 vaccination requirements. Most students have probably already got most of these because they are following what the K through 12 recommendations are from the Centers of Disease Control. Places that you may want to look to try to find these to make sure you have all the accurate dates are either school records, your primary care provider, or even the health department. We do recommend meningococcal B, hepatitis A, and HPV. Those vaccines are not a requirement for K through 12, but they are recommended for college-age students. This is the image of MedProctor. It's as easy as 1, 2, 3. You register for your account, you download the appropriate forms, and then follow the directions on how to get those forms completed, typically taking them to your PCP and having your primary care provider to sign them. Then you upload the completed forms to your MedProctor account, and you're done. This is a one and done. Once you've completed them, this will carry you through your entire career at Miami University. This is an example of immunization exemptions. We are aware that some people choose not to be immunized due to medical reasons or religious reasons. If you go to miamiohio.edu/health under medical records and forms, you can download the immunization certificate. All areas in green are required to be completed for the campus. These are the only reasons that we recognize exemptions or declinations, and that is for medical reasons or religious reasons. Should there be a campus outbreak of a communicable disease or contagious disease, we may ask that unvaccinated students to leave campus, simply for their own safety. The next slide will show you where you can find this immunization exemption form on the Student Health Services website. Just download it, complete it, and then you can upload that form to the MedProctor website. Once it's uploaded, then it will meet the need that is necessary for registration of classes. Immunization deadline is August 1st. Failure to comply with that deadline will mean there's a hold on the class registration, and that prevents students from registering for any future classes. Once you've completed, either uploaded the exemption or uploaded your actual forms that are completed, there's nothing else to do the entire time you're at Miami. If you don't upload them by August 1st, there will be a hold placed on the account and the student will not be able to register for classes. The second topic we're going to cover is health insurance. All full-time students on Oxford's campus are required to have health insurance. Miami does provide a student insurance plan through Aetna. That coverage is effective from August 1st of 2020 to July 31st of 2021. This insurance does need to be addressed each year while you're a student at Miami University. We recommend putting an alarm on the phone calendar to make sure that you get this completed by the August 1st deadline. If you're currently covered by existing health insurance, you just complete a waiver to avoid being charged for the student health insurance. That waiver is available at the website that's on the PowerPoint. The next page will show you what the Aetna student health insurance page looks like. On the left-hand side, you can see that you can enroll or waive, as well as there's how to find a doctor, a hospital, a pharmacy, how to get your digital ID card, as well as the details of the insurance plan. The waiver/enroll portal opens on June 1st and must be completed by August 1st. Students not waiving are automatically enrolled and charged for the Aetna Miami student insurance. The enrollment fee for the student insurance is applied to the Bursar account. Again, the final deadline to waive that insurance is August 1st. I do want to talk about one caveat with waiving the insurance. Many employers provide insurance to their employees. The student may currently be covered under that insurance. The thing to make sure is that the Miami University Student Health Services is considered an in-network provider for your student if that is their insurance. Sometimes employers will provide an insurance and there's a very specific group of providers you must see to be considered in-network. If you go out of that network, the cost is not covered at a higher percentage as it would be if they're in-network. So just make sure that you check to confirm that the Miami University Health Services is considered an in-network provider. Final thing is we want to make sure that all students bring an insurance card to campus. As we're teaching our students to become adults, they need to learn to carry their own health insurance card. They will be asked for it upon registration at Student Health Services, and there'll be a copy stored in their record. If you have any questions, this screen shows my phone number, my email, as well as my clinical manager's phone number and email. The main number to Miami Health Services, as well as Aetna provides us an on-campus, on-site coordinator who is available to the students through the Student Health Service Center. The third person listed on this form is Dr. Large. He is the Associate Vice President of Health and Wellness for Miami University, so his email and his phone number is also listed should you have any questions. We will be holding open office hours on Monday through Friday from 10 to 11:30 between June 1st and August 1st if you have a particular question or a concern and would like to speak to us directly. Outside of these dedicated office hours, a message can be left at the phone number 513-529-3001, and we will get back with you as soon as possible. The one thing I want to promise to you is if your student needs our services while they are on campus, they will receive the highest quality and compassionate care possible. Thank you for your time, and again, welcome to the Miami community.